And we're live. Hey people, how you doing? Welcome to episode 236 of the Sports Therapy Association podcast. My name is Matt Phillisp, creator of OneShotLive.com. And as always, this episode has been recorded live at 8 o'clock Tuesday on the Sports Therapy Association YouTube channel. So, as I announced last week, with 234 episodes of the Sports Therapy Association podcast now recorded, uploaded, and out there free for your education and professional development, we've decided it's time to take a pause from incredibly important information and new weekly guests. Instead, we're going to start a series of shorter, but I think even more important, weekly reflection episodes in which I'm inviting you, the soft tissue therapist, the listener, to pick one past episode that particularly affected your daily practice, and then come on the show with me, very chilled out, and talk to me about it. Simple as that. They're going to be shorter episodes, 30 to 40 minutes long, so you can fit them into your commute to work, whatever it is. And it's going to be such an important, it's going so well so far. The feedback's been wonderful. It really is a chance to reflect back on the amazing information we've got in terms of free CPD, rather than just pouring out more and more and more and more stuff. So far, so good. It's going very well. In fact, last week, I think Nikki Mansfield is even in the house here as we speak. So last week in episode 235, Nikki Mansfield of MMM Therapy joined me on the show to reflect on past episode 137, Healthcare for People with Learning Disabilities, recorded back in February 2023. That one was with Alistair Beverley, the LD physio. Amazing episode. My thanks again to Nikki for setting the benchmark very high. It was amazing, such preparation. Not any pressure for you, Shannon, now waiting patiently down in the lounge at the bottom. But yeah, it was great. Thank you, Nikki. And it's available, as always, on YouTube if you want to see the visual, or you can listen to it on Spotify, on Apple Podcasts, on any of your favorite podcast apps. Right then, so tonight, in the second of this reflection series, I'm going to be joined by sports therapist Shannon Byrne of Rebound Injury Clinic in Dublin, who's going to be reflecting on episode 60, Working with West End Pro Dancers, which was recorded back in July 2021 with special guest Liz Bayley. It was an amazing time. Listening back to it again, it was all obviously COVID time and everything, coming out of COVID and having to go back into COVID. And it was a real dance down a not so wonderful memory lane. But also the information that it was incredible, and it affected Shannon in a particularly interesting and dramatic way. So without further ado, if you have joined us live, thank you very much. Do feel free to ask questions to Shannon and share your own experiences if you remember the episode or any information Shannon talks about. And if you listen to the podcast, then I hope you enjoy it. And likewise, if you've got any questions, then feel free to contact us. Probably go to YouTube and leave your comments there. Is one of the best places. Right, without further ado, let's do it then. Reflecting on episode 60, Working with West End Pro Dancers, with our clinician reflecting tonight, Shannon Byrne of Rebound Injury Clinic.
Hi, thanks so much, Matt.
Hey, Shannon, how you doing?
All good, all good. I hope everyone is doing well.
I'm fine. I'm great. I'm so happy to see you again. I mean, I was just thinking, what I was thinking was, if I was a female therapist, do you know where this is going? And I was Irish, and lived in Dublin, whatever, then I'd probably be you. Because
absolutely,
I've seen your passion and your question asking and everything at Therapy Expo. I think you're quite famous amongst the speakers. I don't know if you know how famous you are.
Oh, wow.
That's a great question answer. No, it's true. And you're an amazing clinician. So it's really nice. You've been on the show before, and I'm absolutely thrilled that you're coming in to have a little bit of a reflection tonight. And you'll be pleased to know that I've just seen coming through the door, drum roll, Liz Bayley is here herself to listen to you reflecting on Liz. Great to have you here. Thanks so much, Liz. I think Alistair last week popping through the door set the scene now. I think all of the people, once they find out, they're going to have to come in and say
the pressure is on for everyone else now to step up to the mark.
I know. Amazing. Thanks for joining us, Liz. It's been such a joy listening back to that episode, and we've talked briefly about it as well. So I'm really interested to hear about how that affected you. Before we do that, I love this. Nikki Mansfield is already setting the pressure. Nikki Mansfield says the only pressure on Shannon is that Liz is in the house. Yeah, we spotted that. Anyway, it's no pressure at all because we're all professionals. So first, Shannon, for people who don't know about you, could you give us a little summary of where you are in the world and what you do for a living?
Absolutely. So my name is Shannon Byrne. I own Rebound Injury Clinic, which is a sports therapy clinic located here in Dublin in Ireland. And it's been up and running for the last 4 years now, I want to say. We're coming up on 4 years. And about a year and a half ago, then we opened our own facility. Prior to that, we were renting in someone else's facility. So we now have a gym setting and 2 treatment rooms. And we now have our own team that's expanded over the last kind of year and a half, which is incredible. I myself have a bachelor's in sports therapy, and my original plan was to go on and do the master's in physiotherapy. But COVID happened, everything went a bit up in the air, and I opened Rebound, and I haven't had a minute since, thankfully. So in one way, it's a blessing, I suppose, because if I had gone on to do the masters, I probably would have been in a very different position. So I'm grateful to be in the position I am and working in private practice, and it always works out in the end, I suppose. So yeah, that's where I'm at the minute.
Fantastic. Very exciting. It's interesting because there's parallels when if people listen back to this episode, then Liz herself had been through sports therapy. She decided to do physiotherapy. And then I think when she joined us in the episode, she'd just come out of her FCP role and decided she'd been able to actually start working in the theatre. So there's interesting parallels there with sports
Yeah,
therapists feeling that they want to do physiotherapy and stuff like that. So what made
absolutely.
you actually want to choose? Obviously, because of Liz. I mean, that's the answer to the
Yeah, of
question.
course.
But apart from it being Liz Bayley with a B-A-Y, L-E-Y, just for anyone who's listening, what made you particularly want to choose this episode 60, working with West End pro dancers?
Yeah, so when you had reached out, I was like, oh, absolutely, I'll reflect on anything. It's one of my favorite things to do. But when I was thinking of one that particularly had an impact on my personal kind of clinical experience and one that I drew a lot from, I remembered listening to this one because this was one of the first ones I listened to from the STA podcast. And I had mentioned that to you when we were chatting briefly. And I had been to the STA theatre in Therapy Expo back in 2021, and Liz had spoken about the foot and ankle, and she had spoken about the dancer's foot and all of that sort of stuff. And I had a chat with her there, I had a chat with you, had a great time. And then fast forward a couple of months later, in March, I was in a car accident. And I was out of work for about 7 months. I'd have a couple of procedures on my back. I'd a prolonged period of time that I needed kind of crutches, or I needed some sort of mobility aid to be able to get around. And I was unsure if I was going to actually get back into the setting that I wanted to get back into, being private practice. And I was kind of scrolling through, I'm assuming it was Instagram at the time, the STA popped up. I'd seen Liz's name and I was like, you know what? I really loved her talk at the STA Theatre in Therapy Expo. I've nothing else to do. I'm going to sit down and listen to this, and maybe that'll kind of just give me a little bit of hope towards getting back into private practice and into clinical experience and working with the populations I love working with. And I sat down to listen to it, and it was amazing to look at the kind of areas that I wanted to be working in, but I wasn't working in at that time. I was just taking anybody that would come through the door. And to be fair, the clinic kind of still does that now. Anybody that's injured or has an MSK injury, we take them in. But speaking to any of the dancers in Ireland, they would probably, particularly young competitive dancers across a couple of different genres, more so than the professional dancers, a lot of them do want somebody who was a dancer and understands the terminology and understands the importance of getting back to their competitions and shows and that sort of stuff. And I've coincidentally kind of become that person for a lot of people, and it nearly feels a little bit like, oh God, I can't believe you said that. But I remember writing out some of my goals and stuff, and I was like, I want to be the go-to therapist in my area for dancers, and to have this safe space for them to come and air out any of their concerns and be able to get back into their sport safely. And it's funny listening back to this then, because there was a parallel in that at the time that I was unable to really work at all. And Liz mentioned having the common ground with dancers. And I just remember thinking, God, I could have this common ground with people with lower back pathologies and that sort of stuff, and all the stuff that I was going through as well. So it actually opened up kind of a slightly different avenue as well, which was amazing.
Yeah, it was amazing timing, but it's unfortunate sense because so you were involved in a car accident, and did you
Yeah.
know that were you dancing until that point, or had you stopped dancing
I
already? What were
had
your plans before
stopped
that
dancing
accident?
just prior to that. So I wouldn't, like I say, I started dancing when I was 3, which was the same as Liz. But I didn't end up on the Moulin Rouge as
No,
much as I'd have loved to.
I
I
did. I mean, we all
I
started
did.
at 3. I was at Moulin Rouge
Come
for a
here.
year. Yeah, just before
I've
Liz.
done it in I've done it in the kitchen plenty of
Oh, okay,
times. You
that's
know
fair
what I
enough.
mean?
Yeah, yeah.
But me and my twin sister did a lot of kind of stage skill growing up. We did freestyle dancing. We did a little bit of ballet. We did a lot of hip hop and that sort of stuff. So from the age of 3 up until about 19, I would have trained probably 20, 25 hours a week across different genres of dance. And I probably would have had a competition every weekend or every second weekend. We travelled all over Ireland and the UK. We went to competitions in Norway and Spain. We were all over the place competing in different styles of dancing. And when I got to 19, I kind of had to sit down and go, God, you're doing this degree. You've got to do all this work experience. It's evenings, it's weekends. You need to do the sensible thing. And it was funny when I was listening back to Liz's episode during the week. She was like, oh, I was awfully sensible. And that, like, I was the sensible one of like, right, look, you're not going down the route professional. I knew I wasn't going to go down that route. So I was like, right, do the sensible thing and try and get into that niche area of working with dancers. And that was my sensible idea, was to go and do that. But it was funny because I had a guidance counsellor in school that said to me, oh, you won't be able to be a physio. You're not going to get the requirements in your exams and blah, blah, blah. So I found that kind of backdoor route and ended up in sports therapy. And I'm glad I did, because I think it's actually where I probably belong a little bit, more so than in a hospital setting in physiotherapy and that sort of stuff. I definitely feel like I belong in private practice.
It's so nice, isn't it, when you can
Yeah.
actually say, oh, I'm kind of glad that happened, even at the time it's
Absolutely.
something terrible. And I think that's a sign of success and fortune in life, when you can look back and go, you know what, I'm happy that happened, because I'm happy where I am now. So it's really encouraging to hear that.
Of course.
Yeah, so in the episode, Liz covers quite a lot of stuff. So I thought we'd pick out a few things. Oh,
Yeah.
in fact, before I pick up some things that I picked up on, was there anything in particular in that particular episode which Liz talked about, which either you were doing or you're doing now, which kind of had effect on your clinical practice?
Yeah, absolutely. I remember Liz kind of briefly mentioning that dancers were performing athletes.
Mm-hmm.
And a lot of the time, they don't put themselves in the category as actually being an athlete. They just kind of end up being a performing artist, or they're an artist first and then an athlete second, or whatever it might be. And then she was talking about their fitness levels. And most dancers actually aren't that fit. They're probably fit for, 3 minutes of a number or whatever it might be. And then they're absolutely dead after that. And I remember looking back at it and going, God, I wonder what I would have been like as a dancer had I have been exposed to strength and conditioning training and more cardiovascular training. And luckily for me, my twin sister was still competitively dancing. So I had started kind of programming stuff for her, and it led to a massive decrease in the amount of injuries that she was getting, thankfully. She still has the odd few. She danced on a broken foot for about 4 weeks, 5 weeks last year, just to see out the end of the competition season, which is absolutely crazy to me that she was able to even stand up, let alone dance. But I was able to implement a lot of the things that I wish I had had as a dancer through my sister. And what we seen very, very quickly was there was so many people commenting back to us of, God, she's jumping higher, or she looks sharper with her movements and everything is moving a little bit more fluidly. She just looks stronger, even in like her outfits that she was wearing. She had a little bit more muscle definition. So it was all like really, really positive feedback. Her coaches were saying, God, she's looking great. The fitness levels were improving, and she was looking much, much stronger than some of her competitors, which was incredible to see, in my opinion. I'm sure some people probably go, God, no, she's not. But in my humble opinion, my sister's incredible. And I remember kind of saying, God, what could we do then to try and open this up to other people? So when we opened the gym, going back a year and a half ago, it was funny because my sister had said to me, oh, everything's closed over the Christmas, there's no training. Can I go up to the gym and do a session on St. Stephen's Day, which is Boxing Day for anyone in the UK? And I was like, yeah, sure, we'll go up. And when I arrived here, she had texted a load of her pals from dancing. And we ended up with like 3 groups of 12 young dancers up to do a strength and conditioning session on Boxing Day. That was like a spur of the moment thing. And I was like, God, not only do the older dancers want to do it to prevent injury, but the younger dancers from the age of like 7 and 8 wanted to be in the gym to get stronger. And I think when you look at gymnastics and Simone Biles and all that sort of stuff, there are a lot more kind of positive imagery for young girls, particularly to look strong and feel strong in their sports. Whereas going back to years ago when I was dancing, it probably wasn't that same imagery that was out there. So we started doing the strength and conditioning classes in the gym for young athletes, and now we do an online program as well for the same reason. And we do it with limited equipment, and we make sure it's accessible to everybody. We do it on Zoom, we record it so people can watch back the recordings and all of that sort of stuff. But Liz talking about the lack of strength and conditioning and the lack of kind of injury prevention, everything is reactive. Everything in the dance world is reactive. You get an injury and then you're sent to a physio, a sports therapist, or whatever it might be, when in reality we should already be there in a screening process. And a lot of the dancers that I work with are amateur dancers that are in a competitive setting that are probably minors. And then the other side of it are dancers that are training in dance colleges. And we have implemented that kind of screening protocol that Liz would have been talking about that she does with the West End pro dancers, that we can screen them prior to them starting in college, and they've got a couple of weeks then to build up a little bit of strength to try and prevent injuries, because they do get, a lot of dancers will get tendinopathy, overuse type injuries, particularly from the amount of training that they do. And like Liz was saying, in the West End, they go into a show, you're straight into rehearsals. It's go, go, go. They might have props, they might have awkward costumes, all of this sort of stuff. And injuries happen very, very quickly. And then us as the therapist then has to respond very quickly to something that might take a little bit longer to actually heal and recover. So the prevention is absolutely better than the cure. And I think that's the kind of mindset that I've taken with a lot of our younger dancers. If we can get them in early on and build their strength and teach them techniques in certain things. And I mentioned to you earlier on, and you probably hadn't a clue what I was talking about, but like a lot of the dancers that I say, okay, do a squat, they automatically go into a plie, and the feet are turned out, the hips are
Oh,
turned
I know
out,
it
and all
well.
that sort of stuff. You knew that one.
I've done ballet. People
Oh,
laugh
you're
at me,
good.
but
Good
yeah, yeah.
job. But it's trying to then, build strength and build strength within the range of motion to try and decrease all those risks of injuries. And Liz really hit the nail on the head in that episode talking about the pro dancers. And whatever we do with the pros, we can filter down into the amateurs, because they're going to be the ones that end up becoming the pros down the line. So the earlier we start, the better it is. And I'd mentioned to you as well, like with the screening, if you look at any of our Premier League football teams or anything like that, they have to pass a medical assessment to get in onto those teams. We don't do the same type of thing sometimes when we're in dance settings. And when Liz was talking about that screening process, it should be something across the board. If you're joining a professional dance company, and I know the ballet do it, but no one else seems to do it. And with the dance college that I work with here in Ireland, it was actually a guy that was teaching in UK dance colleges for quite some time, and he came back and opened his own college there last year. And he's trying to adapt some of the stuff that the UK are doing and bringing it back to Ireland, because we would probably be slightly behind what the UK is doing in a lot of senses. And this is one of the things that he brought back. And even the parents that are enrolling their young kids that are 17 or 18 into these programs are saying, God, isn't this incredible that we can link up with someone that has the knowledge for injuries and screening? And is it safe for my kid to be doing all of this training all of the time? And we had talks about nutrition and fueling and all of that sort of stuff. And it's all really, really positive stuff. But again, if it's not a high level professional setting, it's not really seen anywhere else. So it's trying to filter that into the amateur level and the training level, so that they get used to that by the time they get to professional level, and it's not something they need to worry about because it's part of their daily routine, their lifestyle, that sort of stuff.
It's so interesting listening to you, like as was listening to Liz about your knowledge of what it's like, working in these environments and how you can get injuries from. I think Liz was saying, because she was working on The Lion King at the time. I don't think she was able to say that during the episode, but we can say that now, can't we, Liz? Can we, Liz? Do I have to edit this? Yeah. And she'd worked on Andrew Lloyd Webber's Cinderella and stuff, and it was a case of people always expect the injuries to be traumatic, but a lot of the time it's like because you're wearing a stupidly big animal head, and so your neck is,
Absolutely,
and
yeah.
stuff like that, and the props, like you mentioned, in that. So
Or
the
like
strength thing is
even
such
the
an
things
important
like the
part.
Moulin Rouge and that can type dance and the constant kicking, like with the
Oh, for
type
sure.
of dancing that my sister does, the freestyle, it's a lot of kicking, a lot of jumping. So things like stress fractures and proximal hamstring tendinopathies and all that sort of stuff are really, really prevalent. And it's not a case of somebody pushed me and I fell, or I tripped and I fell. It's always the chronic overuse stuff, and they can be prevented, but we need a time frame to be able to prevent them. And like Liz was saying, if someone's coming in and they're starting a show tomorrow, you don't have enough time to bring them through a prevention type program. But if they're doing these types of things from when they're 8 or 9, and they once a week do a bit of strength training and it's part of their lifestyle, hopefully we'll start to see that they're getting less injured as they get a little bit older, because they have the strength and they have the ability to be able to do everything they need to do within their sport. Like, we wouldn't let a football player after an ACL injury go back out onto the pitch without passing all of our criteria. We don't normally have those criteria. We kind of have to create those criteria for dancers, whereas everything is pretty much set in stone when it comes to our football players. But it's the same with any of our niche sports that we would have. And we don't have the exact guidelines. We have to nearly kind of expose them to whatever it is they're going to do. And we do it all the time with any sport, but I think with dancers in particular, if they're going to a therapist that doesn't understand dance or hasn't been exposed to it or hasn't gone to shows, like I know Liz was talking about Bill Taylor and he engrossed himself in it, then you're qualified to work with the sport. But when you're not engrossed in it, you've no idea what they're doing. Like, I've seen so many dancers with hamstring strains from not warming up correctly and then kicking the legs all over the place. And they've gone to somebody else for an opinion. They get diagnosed and they get a couple of glute bridges, maybe, a handful of hamstring exercises, but they don't build strength at their end range of motion. So as soon as they kick again, they re-injure, and it's something so simple for a dancer to identify that. But if you're not a dancer, and like I remember saying it to one of the kids' parents, like, sure, how is that exercise going to help her when her leg is coming up to here, And her mom was like, God, yeah, that's a really good point. But you don't know what you're supposed to be doing. You don't know what your kid is supposed to be doing if you don't have that qualification.
So
You
for,
know?
for listeners who are listening to this and they're either working with dancers or would like to get involved a bit more with dancers because there's a demand out there, is it still a case where a lot of dancers are immersed in this kind of culture of we're not athletes, we're part of art, darling? Is there kind of still a little bit of that, and part of the therapist role is to say, mate, madam, whatever you want to call them, you're actually a performing athlete and you need to act like a
Yeah.
performing athlete? Is that still
Absolutely. I
something
think there
today
is
happening?
still a little bit of that. And like, I suppose we are moving out of it a little bit more. And I think the Olympics this year is when I start seeing some of the younger kids that were in around 13 or 14 and they're exposed to social media. And I had one kid in particular that said, Shannon, how do I make my legs as big as Simone Biles so I can jump that high? And it was the first time I heard a really young kid say to me, I know that having big legs
It's
like
pretty
that
healthy.
means I have strength and that will support my body when I'm doing these really kind of intricate movements and really high jumps with twists and all that sort of stuff in it. And I just kind of had to take a step back and go, God, isn't that incredible? And then we had to sit down and have the conversation about nutrition and fueling and all that sort of stuff to make sure that she wasn't overtraining, because that's the other side of it, like particularly with the amateur sports. And some of these kids do crazy amounts of training. But I do think we're definitely shifting more towards the performing athlete. But I do think still, particularly with the amateur level, it's like, sure, they just go to dancing. I remember being in school and we'd have boys in school that'd say, sure, you don't even play any sports or, whatever. And then it'd come to doing a 100-meter sprint. And I'd kill anybody at a 100-meter sprint at that stage because I was so good at the short bursts and the explosiveness. But sure, I had no endurance whatsoever. Like, I wasn't fit when I think of it now. Do you know what I mean? So I definitely think there is a little bit of a shift, and I think there's some stuff on social media that's allowing for that positive shift. And there's a lot of athletes, and not just in dancers, but when we look at like gymnastics and that sort of stuff as well, and we link all of those in, it is creating that kind of positive mindset, because we don't see an awful lot on social media about say your classical dancers and your ballet dancers and that sort of stuff. We're not seeing an awful lot of that on social media. Well, I'm not, but we are seeing more on TikTok of the performers that are in musical theatre and they're backstage and they're having the crack and all that sort of stuff. And TikTok is exposing us to people's daily lives. But I think from seeing that sort of stuff and seeing the behind the scenes, it's kind of encouraging young dancers to realize, well, actually, this is a full time job for people when they move on. And this is a full time role and it's a lot of work. And we have to be seen and we have to be treated as athletes. And I think the shift is happening on the dancer side, but I don't think it's happening in the general population. So, what I kind of see is that the parents don't really believe that the kids are athletes unless they're at a really high level of competition. And then you see, like, say, even school teachers and PE teachers and that sort of, God, they're dancers, or whatever it might be. Um, but the dancers themselves are starting to put themselves into that category a little bit younger, which is really, really nice to see, because they are going to become the professional dancers that are on the West End and in all of those musical theatre shows down the line. So it's nice to see that shift happening in some of them really young. But there still is a lot of the kind of negative connotations in dance, particularly in freestyle, that I've seen of like, I can't eat before I perform, I'll get sick. And you're trying to break down these barriers and kind of go, all right, well, okay, well, you're nervous. It's normal to be nervous, but you need to fuel your body. And here's what you need to be eating and how you can fuel your body healthily. Yeah, if you have a McDonald's, you're probably going to get sick. But if you can, give yourself some time beforehand. And I was like, nobody ever sat me down and said anything like that. If I didn't eat for the full day at a competition, someone would probably go, God, but she gets real nervous. Do you know what I mean? And it's not really an excuse. So it's definitely something that when you look at it more holistically, and you look at the strength and conditioning approach and you bring in the nutrition, you bring in everything else, you get that at the professional level a lot of the time. But filtering it into amateur sports is definitely where it's going to build a kind of foundation, start building the bricks up. Because in Ireland, if we look at like the GAA or the football or anything like that, we've got kids football teams that are under 14 or under 15 that have a physio standing on the side of their pitch on a Saturday morning. But we've got dancers in a hall. We've probably got 800 or 900 dancers in a sports hall at a dance competition. And we've got one guy from St. John's Ambulance doing first aid, and all he's doing is an ice pack and maybe a compression bandage. And you're kind of going, well, where is there's no level playing field there in terms of who the athlete is.
Mm-hmm.
We're treating the under 14 football players like professional athletes, and then we have kids that are training like professional athletes that are probably doing 20 upwards of 20 hours a week of training, and they've got somebody with a compression bandage and an ice pack when they get injured, and then they don't know whether they're able to train or not. So if I'm at a dance competition with my sister, I normally get called over. I've been called Nicole's mum multiple times, and we're twins, so that's really offensive. But people just assume that because Nicole dances and because I'm a sports therapist and I'm professional, that I must be her mother. But a lot of the times I'll get called over and I'll be told, oh, first aid told her that she can't dance. Can you have a look? And you have a look and you go, oh, okay, right, well, can you do this? Can you hop? Can you do that? You know, go through a couple of things. Okay, right, well, you can't do X, Y, or Z, but you can do all of this. So take the kicks out of the routine, or take, you know, whatever single leg stuff. And we'll adapt the choreography and we'll change it and they can go back on. And Liz said something similar about one of the principal roles in one of the shows, that if there's not a swing to go on and it is something, we can change choreography to still make it work. And the thing with the amateur sports, the ones that I'm working with a lot, there's a lot of soloists. So there's no one to go on in your space. So you've got to adapt and kind of overcome and work with what you've got on the day. And obviously, if they can't take 2 or 3 steps, or, you know, if you're going through your auto ankle rolls and you think that there's a fracture there, you think it is more of kind of an acute injury or something more traumatic, yeah, no, they're probably not going to dance. But in a lot of the cases, the kids want to dance. That's what they're there for, you know. So it's trying to allow them to safely adapt and change the choreography so that they can dance. And I think that's something then that having the experience as a dancer allows you to do. Whereas if you didn't have that experience, you don't get the ability to then be able to do that. And it's not really something you can learn unless you've been in that kind of sport. And like that, for me, there's certain styles of dancing I'd be really good at doing that with. But if you put an Irish dancer in front of me, I'd probably be looking at the dance teacher going, is there something she can do instead of that bit, you know? And in Irish dancing, they've got set dances, so they have to do this specific routine and everyone gets marked against each other. So sometimes it's not possible to do that. So it's trying to think on your feet with some of those.
Yeah, it's. I'm imagining the listener listening to this who maybe wants to work with dancers and is a bit tentative, and it's interesting because both yourself and Liz have cleared up some of the misconceptions. So for one, for example, this idea that it does help, obviously, and Liz said this well in her episode back in 2021. If you are a dancer, it's a shortcut to that therapeutic alliance with the dancer because they know you've been there. And also you're going to be able to talk their language much easier. And like you say, you're going to have an idea of how to tweak things and change choreography. But it was nice that Liz pointed out, and you've mentioned as well, that if you are someone like Bill Taylor, who was actually on the show before talking about male pelvic health, amazing guy, and works with Scottish Ballet. He's like the head physio, or what's his official title with Scottish Ballet? I can't remember now, but amazing person who everybody goes to. I think he's still with Scottish Ballet. Yeah, consultant physio. But he didn't know about it. He's not a natural dancer. He probably has I can imagine him having a little jig by himself in his bedroom, but that's my own personal thoughts. But yeah, he did. He got a book and he devoured it and he learnt it all so he could understand. So it is possible.
Absolutely. And like I lecture in a college in Dublin and their bachelors of science in sports therapy. And I try and encourage as many of the students as possible when they're doing their placements to go and work with dancers and see dancers, because like Liz says, you asked her, I think, about the top 3 injuries, and she was like, oh, a lot of ankles and a lot of knees and a lot of hips and a lot of shoulders and a lot of lower
25
back.
minutes
And
later.
and you know, and there was everything, but that is really the case. So I kind of link up some of the students with the dance college that I work with so that they can see dancers in training and what they go through, as well as what injuries they get. And a lot of the times they learn an awful lot more in that short period of time because they've got so many dancers, so many different injuries, so much going on. And they're practically getting a show half the time because they're watching them dance and going, oh my God, isn't this incredible? So it's definitely something that you can expose yourself to. And like I said, I'm not an expert in every style of dance. But that's when you then go to the coach or the choreographer or whatever it might be to work with you then to make those adaptations of, right, well, we don't want them kicking or we don't want them landing on that one foot. Can they change the jump to land on the opposite foot or whatever it might be? And you can work through it that way. Absolutely, yeah. And when you look at Bill Taylor, he's a perfect example of that because he engrossed himself in it. And you don't have to engross yourself in it, but if you have a dancer that comes to your clinic, ask them questions. Or I always say to the students, ask them to show you a video on their phone. Show me what you actually have to do. And then let's make your rehab look as specific as that before we allow you to go back, because that's how all of these re-injuries are happening so frequently. And Liz made a really good point about, like, it's never just an ankle sprain. And the amount of dancers that will say to me, "Oh, I just have weak ankles." You're like, you're a dancer. Your ankles are supposed to be pretty bulletproof. You're particularly if you're looking at ballet dancers and they're on point all the time, or dancers that are dancing in barefoot or they're dancing in heeled boots, or your ankles should be pretty bulletproof for the most part. And yeah, if you have an ankle sprain that's not rehabbed correctly, you're probably going to have another one. But it's never just the sprain. There's always something else that's going on. And it's really important then to address that and to try and figure out what do they need to be able to safely go back without risking another injury, particularly if they're on contracts and that sort of stuff and they have to do however many shows during the week, or if they have a competition coming up that's really important to them. It's really important not to expose them too soon to getting back into that sport and kind of have that gradual progression like with any rehab. But I think when people see dancers, it's nearly like Nikki's episode last week. People see learning disabilities and they're like, "Oh, I'm not qualified. I don't know how to do that because I don't have the experience."
Yeah.
Whereas you do have the experience, but you have to look for the clues, And I, like me as a dancer going in and doing sports therapy, and all of our rehab scenarios in college were rugby players and Gaelic players and football players. And I had to go off and study those sports. And I try and explain to the students, you have to study the sport that your client is doing. And it'll take you an extra little bit of time, but it'll help you then when you're programming their rehab to understand what it is they actually need. And then when they don't get injured, all of a sudden now you're the dance specialist, you're the one that's in that kind of niche area because you've successfully got somebody back. And they rave about it to the other parents and the other dancers and the dance teacher and whatever else. And you don't need to be the dancer to do that. You just have to be able to research. But sure, we can all research. That's what we do all the time.
This is a good example, I think, of where we mentioned this with Nikki last week and the research supports it, that for successful outcomes, often the most important factors are the empathy, the active listening,
Absolutely,
the alliance with the patient, rather than just a tap of knowledge which you're going to pour out of them. So, and this is a great example. Even if, let's imagine you were a great dancer, amazing, trophies all over your house, but you're not very good at empathy. I mean, and you just start spouting out what this dancer's got to do and handing them out protocols. You're not going to have as much success as the person who's got lovely empathy and they listen and they're not a dancer or they haven't done this particular style of dancing. But if they're listening, engaging, going, "Tell me about it. Show me a little bit. So does this mean?" And asking questions and all that and showing interest. Great results. So that's a good confidence booster.
And you know what? I think for me, I was always the very type A. This is how it has to be done. This is the answer to the question. And after being in the accident and having everything and kind of having a bit of an identity crisis with my entire life, I think I developed a lot of empathy in that situation for myself and for my clients, particularly people that struggle with chronic pain and that sort of stuff as well. So like that, it's developing further tools. Yeah, we can all go and do a CPD course, but if you don't have that level of empathy or the desire or want to actually help somebody, people are going to end up re-injuring and they're going to go to somebody else. Do you know what I mean? And that's at the end of the day, we all work off word of mouth and referral and all of that sort of stuff. And the better you can be an advocate for your client, regardless of their sport, the more people are going to rant and rave about you.
Definitely. I should point out, just the people listening to the podcast, Bill Taylor, he's not with the Scottish Ballet anymore. He was the consultant physio, but he's not anymore. So there we go. But I wanted to point out as well that it's definitely an episode to listen to with Bill Taylor. I did have it here just now. Yeah, it was episode 123. And it's all about male pelvic health red flags. And there's scenarios with dancers in that as well. But Bill Taylor, amazing educator, great person, well worth listening to. The other thing Liz mentioned as well, and you've kind of tapped into it as well, was mental health of dancers. And we know, and Liz mentioned on the show as well, that not all, but a lot of dancers did get into it where validation was one of the kind of factors maybe. And there's self-esteem issues that go with it as well. But in your experience, is that still something which you need to be, I mean, everyone needs to be aware of the biopsychosocial factors, but with dancers, is there particularly an element there that you have to keep an eye out for?
Absolutely. There's definitely still that element there. And I think there always will be. Like, as long as we've got a brain in our head, I think there'll always be elements of mental health struggles for everybody. And I think that's one thing that the dance college that I'm working with at the minute do really, really well. They bring a psychologist in at the start of the year, the same way they bring me in. They bring like a nutrition talk and the whole lot to give them an idea of this is what we should be thinking in terms of your physical health, your mental health, and your nutrition, and making sure that you kind of have that well-rounded approach. And it's trying to filter that back down the line then as well. And it can be quite detrimental to somebody's mental health if they do have that identity crisis then of, oh, I'm injured and I'm missing my biggest competition of the year that I've just spent the last 12 months training for. And there's no point in me continuing on, because by the time it gets to next year, someone else will have won my title and I'm not defending the same title anymore. And, and this is going back into the amateur sports more than the West End pros. If you look at the pros, then they're on contract. If they get injured, they might end up out of a contract or struggling to find work. And if that's your full-time job, again, that's going to take a toll on the mental health and your financial kind of position as well. So it's something to always be aware of and to be cautious of. Like, I would have a handful of dancers that would be kind of semi-professional or professional dancers, and when they are in contract with something, they would then have to kind of they come into the clinic and they're like, well, what can I do to perform? I have to perform, otherwise I don't get paid. If I don't get paid, my bills don't get paid, and that's a real kind of a lot of pressure to put on somebody that's quite young as well. And then I suppose, like we mentioned, when we look at the kind of body image and body dysmorphia and that sort of stuff in really young dancers as well. So I do see that there's more of a positive shift happening over the last kind of couple of years, which is amazing to see. But it really needs to kind of come from all angles, of including parents and coaches and other dancers, and having that kind of positive imagery, positive self-talk, particularly during the rehab experience for our clients. It's always like, this is a stepping stone to get you back to there. Each time there's a progression, really kind of driving that home of, wow, aren't you doing incredible? You're getting one step closer to being back on the dance floor, back on the stage again, because it can be quite difficult. And it's difficult for anybody with an injury. It really is, and we know that. But when it's their livelihood, or like that, they're training 20 hours a week and they might not be seeing their friends as much, and it does really take a toll on the mental health. So it's just being aware and being cautious of it, and like that, if it is somebody that's a minor, pulling the parents into the conversation to kind of take a look out for them as well. It's really, really important in my experience.
Great stuff. Yeah, really cool. Okay, well, look, it's 8:39. We're going to start thinking about wrapping these shorter. I could easily talk to you for another half hour, an hour. Fantastically, it's great listening to you, and it's really nice bringing back the great things which Liz said in that episode. So, just to let people know, and Liz, you can update me on this if any of this is not applicable. But where is Liz Bayley these days? Because this was quite a while ago and things have changed since then. It's a great episode to listen to. But these days, Liz is pretty international. She has a number of courses. If you're interested in going on her courses, then go to the website lizbaileyphysio.com. To give you an idea of the courses, there's a 1-day ankle, which is from diagnosis to end stage rehab. There's a 1-day foot course. There's a dance physiotherapy explored. We look at common injury screening, dance specific rehab, etc., etc. And then there's a foot and ankle fundamentals, which is with Lizzie Marlowe, and it's a systematic approach to diagnosis and treatment, which is available as a 1 or 2-day course. Have a look at the website. It says on there, I'm not sure which of these have already happened, but it's going to be in Dubai, Switzerland, Serbia, America, Denmark, and Ireland. Has that happened yet, Liz? You better let us know the date of that very quickly. But yeah, so have a look at the website. And if you have got any questions, then we can feed them to Liz, or I'm sure there's a contact place you can go through there, lizbaileyphysio.com. Do please make sure that when you type in Liz Bayley, it is Bayley, or we'll never hear the end of it. I think Liz has probably got the website Bailey, just to get a redirect. That would be sensible, Liz, if you haven't done it already. But yeah, it's a Bayley. And anyone who knows Liz will understand how that means and how important it is to her. But anyway, so yes, people, we've been reflecting on that episode 60 of the Sports Therapy Association podcast, working with West End pro dancers, which was recorded back in July 2021 with Liz Bayley. If you're interested in other episodes with Liz, then there's an episode 33 going back even further to January that year, which was all about virtual consultation for dancers, obviously with the COVID pandemic and everything. That was very topical at the time. Then we had the episode 60, then later on 81, where Liz joined Ian Linane and David Poulter for a fascia focus, which is an open group discussion, which is very interesting as well. And then Liz last joined us October 2022 which was episode 122, which was the dancer's foot, which was a lot to do with about our course and everything, and how our ideas have evolved since we last spoke to her. So check those out. Available as always on YouTube or on podcasts app of your preference. And reflecting on that episode, just to let you know, has been Shannon Byrne of Rebound Injury Clinic in Dublin. And Shannon, if people want to keep in contact with you and I'm interested in you and your business, then we've got the website, which is reboundinjuryclinic.ie, correct?
Yeah, that's right.
Fantastic. And then active on Instagram, Rebound Injury Clinic, and Facebook, Rebound Injury Clinic. Great marketing.
Nice and easy.
Very simple. Very good. Man, number of people
My twin sister is a marketing expert. She does everything for me. I get in trouble for not having stuff like this behind me, but it works.
Oh, no, great. It really is important. Alistair, for example, last week, sometimes it's underscore, the LD physio underscore. Sometimes you have to separate it. He didn't have your sister. They're obviously helping him. Liz Bayley says, thanks for spelling it matters. It does matter. It is important, Bailey. And she also says, great job, Shannon. You're doing amazingly. Fantastic.
Thank you so much.
And I agree. Really nice. And like you said earlier on, just to let people know, you have got an online strength and conditioning program, haven't you? That would be suitable for therapists and or clients or both? Or
so we run the program via Zoom. It's specifically for dancers and we do it live each week and we change up the program that they do. But like that, if there's any therapists that are interested, or maybe they have dancers that are missing that element of strength and conditioning and want to refer into us, we do have the information up on our website. And if anyone has any questions, they can pop us a message. We're incredibly active on Instagram.
No, it's well worth following. Really cool. So Glenn Murphy, MBE, says that was really enjoyable. There you go.
Thank you so much.
You can now put that on your CV. Sir Glenn Murphy, MBE, has mentioned that. So there you go. That's an update for your website. Fantastic. Thank you so much for sharing your time, Shannon. It's been really lovely. I love just hearing the passion in your voice and your experience and history and everything and celebrating that episode. So cool. Really interesting. So thank you for your time.
Thanks so much for having me on. I really appreciate it.
I thought we'd set the benchmark high. This is going to happen every week now, isn't it? I'm going to stop talking about benchmarks because you've leveled it. It's like, there you go. Everyone's got two to compete with now. There's no competition at all, people. And in fact, if you're listening to this and you would like to to be on the show, then I'd love to hear from you. The only criteria is basically that you've listened to a past episode. Just choose one that particularly affected you. We're keen to hear how it affected your clinical practice or you as a person or anything, your business. Obviously, you'll need a PC or a laptop, preferably not your phone. Hey, Shannon. And you need a quality internet connection, webcam and mic. But we can talk about that. If you're a bit nervous, then I'm double interested in hearing from you. We can set up a Zoom call or something just to talk you through it. Obviously, you're going to be a little bit nervous, but from talking to my guests over the last 200, well, not all of them, because a lot of them were very au fait with podcasting. But people who aren't that confident, after you feel it is a bucket list tick. It's like, wow, I did that. And it really can, that confidence we know can open up all sorts of avenues for you in terms of collaboration and networking. And even with your clients, they'll notice it as well. It's something for you to talk about and celebrate. So do let me know if you're interested in being on the show to talk about a past episode. Next week, I will be welcoming on April the 15th, 8:00 on YouTube, as always.
Birthday.
Your birthday. Fantastic. Oh, wow. Well, no, next week there's no show. Next week we will be celebrating. Next week is going to be Anna Marie Mazzieri and Sarah Jones. Sarah, who is in here tonight, actually. Sarah, how are you doing? Sarah Jones says, great chat, enthusiasm. I'll catch the first bit that I missed tomorrow. Great, Sarah. Good preparation for next week. Don't forget, I'll send you an email. But yeah, Sarah Jones and Anna Marie Mazzieri are going to be here from the ST School, and they're going to be reflecting on episode 214, which was recorded last September. What values make a professional therapist? Where with me for that was my guest, Martin Christensen, who's probably, and he'll be pleased to hear this, the physio or ex-physio now, who has made me feel most uncomfortable ever in my life, particularly at Therapy Expo. He's just got a certain way that just makes everyone feel uncomfortable. But boy, he puts out some home truths with that. And it's a fascinating episode. And he was talking about how to really help, putting it in a nutshell, to really help the person in front of us, do we hinder their progress if we just maintain a strict kind of the way we should dress, the way we should look, or should we be thinking more of reflecting the person in front of us? So if they're more chilled out in jeans and a t-shirt or whatever, should you be reflecting that rather than forming a barrier by maintaining this professional facade where really maybe you're not being that professional the way you talk? So really interesting kind of philosophical but practical stuff, which Anna Maria and Sarah will be talking about me and reflecting on in next week's episode. So I do encourage you to come along and join us live if you can. Nikki Mansfield, guest from last week, has said, Shannon and I can just sit back and heckle from now on. There's method in the madness of going first. It's true.
Absolutely.
You can. It'd be lovely to see you as well if you can come back. Right. Thanks again, Shannon. Been really great. Thank you so much for giving up your time. Really appreciate it.
Thank you. I really appreciate being invited.
Hopefully, thanks to everyone who joined us live as well. Thanks for the great questions. Thanks, Liz, again for popping in. Really nice to catch up with you. Hopefully we'll catch up face to face somewhere. Maybe in Ireland. When are you in Ireland? Let's find out. Maybe we could hook up and go to Shannon's place. Yeah,
Absolutely.
So we'll form a WhatsApp group afterwards. But anyway, hopefully see some of you listeners back with us. If you want to join us live, then Tuesday 8:00 on YouTube. That's where we are. So until then, thanks everybody, and take care of each other. Bye bye.
Thank you.